Okay, so thank you so much, Mike, and to the kind of wider Essex team for inviting me to talk on behalf of the Little Minds team today about using a realist approach to design and test a mindfulness program to support children in early years. So I just wanted to start very briefly by saying that I'm by no means an early years expert, and nor am I a realist expert. And in fact, this project and my involvement in the project was the first time that I had used a realist approach in research. But I found the realist approach to be really accessible. And so I hope that this talk helps to provide some useful details on the approach, and hopefully it can demonstrate the real sort of depth and complexity that this approach can provide when it comes to program development and evaluation. So a brief outline of what I'll be sharing today. I'll talk you through how and why Little Minds came about as a research project, a brief overview of the realist approach and sort of methodology, and then I'll talk mainly about how we used it to firstly design our mindfulness approach, and then how we then tested it and refined it using a realist evaluation. And then I'll finish very briefly by just talking about some of our future plans and sort of reflections on where we might go next. And yeah, as Mike said, you feel free to raise your hand if you have any questions, or I'm more than happy to answer questions at the end as well. So the context in which this project emerged from was that over the last sort of 4 or 5 years, we've seen increasing numbers of children starting school with poorer speech, language, and communication skills. And this was certainly intensified by the COVID-19 pandemic, where there was a lack of access to quality educational provision, a lack of sort of socialization with peers. And the Department for Education a couple of years ago kind of released a report which found that there was a real kind of significant need to focus on improving listening, attention, understanding, and speaking skills within the early years context. And when we think more broadly about what's going on at more of a sort of global level, we can see that there are also kind of wider well-being risks and issues in the early years context as well. We're seeing increasing poverty and cost of living crises, and all of these sorts of things that have been emerging in society are also kind of heavily impacting on children and their well-being. So with this context in mind, we felt really compelled to explore how we might be able to support these issues in an early years context. And we thought that mindfulness might be a really meaningful way of doing this. So mindfulness has been used in many other contexts to support well-being. It's centered around compassion, non-judgment, living in the moment, being attuned to experiences and sensations. And there's already a lot of research on the kind of benefits of mindfulness in an early years context that found that it supports improved executive function, children's focus and attention, their self-regulation, and all of these sort of positive developments contribute to a positive learning environment. And so we thought, well, if mindfulness, has been evidence to do all of these positive things, then perhaps we could also use it as an approach to support children's speech, language, and communication development. So that's really where the project sort of stemmed from. And for those that perhaps don't have much experience in mindfulness, just to give a sense of what a mindfulness program might look like in a sort of children's capacity, these are some of the common areas that mindfulness programs tend to explore with children. So firstly, tuning into the senses, doing things like sensory activities and nature walks where we're thinking about the five senses, learning about bodily sensations. With the children, we've been doing things like getting them to tune into their heartbeats after they run, or focusing on their breath and the feeling of the breath, thinking about the sensation in their hands when they clap or when they sort of stomp their feet. So really sort of tuning into those sort of physical sensations. Also things like exploring feelings and emotions. So really central to mindfulness is noticing and paying attention to things when they emerge and to think about what they feel like. So we've done a lot of that with the children. Practicing kindness and compassion, both in relation to yourself and being kind to yourself, but also to others around you. And also this idea of zooming in and out. So it's around this sort of changing focus of attention. So looking at the really tiny details and then sort of zooming out to capture lots of sort of broader details around us. These are some kind of examples of activities that capture the kind of key components and principles of mindfulness in a sort of child-friendly way, I suppose. So we found actually that many mindfulness programs or interventions for children did already exist, for example, the kindness curriculum and the DOPS curriculum, and many of them have been used in early years practice and in a research capacity to test the effects of mindfulness on children. But as I mentioned earlier, we felt that there could be a possibility that mindfulness could be used to directly impact on children's speech, language, and communication. And this is not a link that had been previously tested in a research capacity. So, with that in mind, we had two kind of overriding aims here, and one of them was to explore the possible contexts and mechanisms through which mindfulness can support children's speech, language, and communication. And then the second one, once we sort of had that evidence and that understanding, was to co-create an evidence-informed mindful pedagogy to support communication developments in early years. And the language here is important. So I've sort of put the pedagogy in italics because we've actually moved away from what we would call an intervention or a program to a broader pedagogy or approach. And I'll explain a little bit more about that later on, but the language to us was really important. So we decided to use a realist evaluation to go about developing this program. And whilst program evaluations typically determine whether change happens through sort of capturing the empirical reality, for example, you might figure out the outcome of the program on users. A realist approach aims to go much deeper and strives to explore those kind of underpinning mechanisms which trigger different outcomes. And in doing so, kind of helping us to identify the context that activate those mechanisms. So, in essence, realist evaluation provides a really structured way to think about how programs and interventions lead to specific results, helping to explain not just what happens, but how, why, for whom, and under what conditions. And I think the really key thing that for us that made the realist approach really kind of enticing is that it acknowledges that programs and interventions don't always work in practice. We might have these great ideas and plans and a program that we think works really well, but then you try it out in different contexts and it just doesn't work in all places. So the realist approach acknowledges that context is crucial to the success of a program or intervention or pedagogy, as we're calling it. So the sort of crux, I suppose, of a realist approach is that they use this heuristic tool called a context mechanism outcome configuration, which is a real mouthful, and I will just call it CMOX for the duration of this presentation. But these basically are configurations which help us to develop theories which shape the program development so that they are contextually specific. So CMOX are the sort of specific hypotheses that detail how a particular mechanism within a given context is expected to lead to a certain outcome. And then from that, we build what we call program theories, which is a broader framework which explains how and why a program is expected to work. So CMOX are the sort of building blocks of a program theory. So to give you an example from a kind of different context, if we're thinking about developing a program to support mental health in the workplace, we can break it down into these three areas. So you can consider that the context in this workplace could be that there's a high workload and long hours. And the outcome that we want to see is improved well-being and reduced burnout. So what we would be figuring out is what is the mechanism that happens in that context to lead to that outcome. So in this case, the mechanism could be that if we make changes to work habits and changes to work prioritization, then that is triggering that mechanism to then result in that outcome. So in a realist evaluation, you develop many, many, many CMOCs, and you try to capture all the different contexts, all the different mechanisms, and all the different outcomes that you're kind of wanting to get from the program. And at the beginning, you'll start with a lot. You'll have lots of hunches, things that you think might be happening just based upon a little bit of reading or your own experience in the context. From my point of view, I didn't have any of that experience, so it did sort of come from those initial bits of reading. But over time, you refine these CMOCs based upon evidence that you collect and further testing. So these CMOCs are developed in kind of three key stages, or the realist evaluation has three key stages. And it is a really kind of iterative process. There's a lot of back and forth between the three stages. It's not necessarily in kind of chronological order. But these three stages are essential to the success, I would say, of a realist evaluation. So, firstly, you have what is called a realist evidence synthesis, and it's a very sort of wordy way of saying you're looking at the existing evidence out there. So, in our project, we looked at peer-reviewed papers, for example, randomized controlled trials, which tested mindfulness programs in early years context. We also looked at grey literature, so commissioned reports, perhaps in the public sector or from charities, to kind of add to the evidence that we had in this sort of area. We also developed a content expert group, and again, a very sort of wordy way of saying we had a group of experts in the field that we went to for their advice and for their expert insights. So for us in the Little Minds project, we had two early years educators, one in a reception class and one in a preschool class. We had three leading academics in early years sector. We had a mindfulness instructor, an educational psychologist, a realist methodology expert, and an intervention expert. And for us, because we hadn't done realist approaches before, the realist methodology expert was really helpful to draw on at the beginning, to have a bit of training and just to talk us through the different sort of stages and processes that we needed to think about. And then the third stage is the actual kind of trialing of the program. So implementing a program and testing its success. So we developed what we called a mindful pedagogy. We trained early years educators on how to implement it, and then we evaluated the impact of that pedagogy in their specific context. So this gives you an idea of this really sort of highly iterative process of a realist approach to program evaluation. And this slide will come up again and again with kind of a focus on different stages as I talk you through the sort of journey that we went on. So we began in May 2023, and one of the first things that we did was a very small preliminary literature search. We just read a few papers in the area of mindfulness and early years, and we came together as a team and discussed what we had found. We then had our first meeting with our expert team to discuss the project aims. We shared our initial sort of hunches and theories about what we thought would work in an early years context, and we decided what we would search for in our evidence synthesis. So we then, conducted an evidence synthesis. So this, as I said, was looking at all the available literature on mindfulness and early years, and we developed theories to help explain how, whether, why, and in what conditions mindfulness works in early years contexts. So to break down the evidence synthesis a little bit more, we conducted a very sort of systematic literature search using our university's sort of library search function, which had access to hundreds of different databases, and we were identifying literature that was relevant to our aims. We developed a wide range of key search terms to ensure that we didn't miss anything relevant. So different contexts and different, the academic compared to the professional, for example, will use different language to talk about what could be a very sort of similar thing. So we wanted to make sure that we captured all the possible kind of terminology so that when we are doing our initial sort of evidence search, we are picking up on all of the relevant stuff. And actually, our expert group were really, really essential in helping us to decide on the key search terms that you see on the left there, and also on the inclusion and exclusion criteria. So it was really important that we had a really clear set of what we included and excluded from our evidence base, because otherwise we could end up with thousands of papers which we would begin to read to then find that they weren't directly relevant to our project. And the content expert group were also really helpful in pointing us in the right direction to where we could find the evidence. So databases in early years context, different journals, grey literature, that was really, really helpful, especially because as a team, we didn't necessarily all come from that early years context. So our initial literature search came back with over 500 results, but as we delved deeper into them, we were soon able to, use our inclusion exclusion kind of criteria to figure out which ones were truly relevant to our aims. And in the end, we were left with 62 documents that contained evidence which would help us to figure out what we thought might be going on in relation to mindfulness and speech and language developments in early years. So from this, we had our first go at developing some CMOCs. So we would pull out different contexts, mechanisms, and outcomes that we saw in the evidence that we collected, and we made them into those configurations that I gave you an example of earlier. So some of the key findings from the evidence synthesis were these. Firstly, there were some really positive links found between mindfulness and children's executive function, vocabulary acquisition, and self-regulation. There was an interesting sort of bidirectional relationship between executive function and speech, language, and communication that we wanted to sort of tease out and unpick a little bit more. Executive function, by the way, is a range of sort of cognitive skills that are kind of developing very quickly in an early years context. They help children to plan, organize, kind of retain information, make decisions, and that sort of thing. So really, really essential to positive learning and sort of development. We also found that mindfulness supported the practitioners or educators themselves in terms of their own levels of stress and their own well-being. And some interesting things that came out was that the mindfulness intervention seemed to have the biggest improvement for those that began with kind of lower levels of executive function or speech, language, and communication. And something that was really important to us was that actually the volume and quality of the mindfulness training that the early years teachers and educators had was really important in kind of determining the success of the mindfulness program once it was implemented in their setting. So we developed a range of CMOCs based upon all of this evidence, and this is just a snapshot. There was a lot more from it, and we took it to our experts to get their insights. So we're now here at Content Expert Group consultation. So we sat down with our experts, we reviewed all of the CMOCs that we had developed, and we helped, and they helped us to really refine those CMOCs. So this was really, really important because whilst the literature might say one thing, this might not always be true in practice. And the expert insights helped us to add real sort of nuance to our understanding. So to give you an example, the literature said that if early years educators do 5 to 10 minutes of mindful practice every day for 10 weeks, children's executive function will improve. But in practice, this is not realistic. Anyone from an early years setting will know that they're really busy, really chaotic spaces at times. Not all children are going to engage equally in those mindfulness activities. Sometimes there might be different priorities in the day. And so these expert insights helped us to begin to develop more realistic theories about what works for whom and in what conditions, so that when we go on to have our first go at designing a mindful pedagogy, it actually works in various early years contexts. So that was really crucial. So following the consultation, we began to make sense of how contextual factors really impacted on the success of a mindfulness program. So our understanding of what had been done before in relation to mindfulness programs in early years was that often the interventions weren't flexible in meeting the individual needs of learners. So often they had quite inaccessible language or instructions, which weren't kind of weren't accessible, for example, to children with English as an additional language or children with special educational needs. Sometimes the concepts and the activities that were included were too complex for children's developmental levels. When we think of mindfulness, it can be quite an abstract concept or kind of quite metacognitive. It's sometimes thinking about thinking, and this is too complex for 2 to 4-year-olds in many cases. Often we found that interventions involved an external instructor, mindfulness instructor, coming in and delivering mindfulness activities. And actually conversations with our experts helped us to realise that would likely be a lot harder for children to engage with because they're a stranger. And also the instructor wouldn't be aware of the children's needs. And so that was a really key thing that we brought forward in thinking about what our own programme would look like. We also found that the interventions were typically very highly manualized and prescriptive. There were expectations around the quantity and the duration of activities, the need for all children to engage. Again, as I said earlier, this is quite unrealistic in early years where adaptability is a really key part of early years practice. And it also is a very rigid approach that is quite at odds with early years practice, which is often quite exploratory, child-led, and play-based. So again, this is something that didn't really fit with the day-to-day kind of practices of early years. And early years educators talked about how they would sort of lack agency to implement the program as they saw fit. So they weren't able to base it on their child's needs or interests. So when we're thinking about longevity and sustainability of an approach, this is something that perhaps wouldn't happen if we stuck to a very prescriptive approach. And finally, the training and support for the educators on mindfulness and delivering mindfulness in their context was either kind of far too much training expected. Educators were sometimes asked to do an 8-week mindfulness course. This was quite costly. It was a big time commitment. Or it was the opposite end of the scale where there was a real lack of training, which left educators unprepared, overwhelmed, or lacking confidence to really embed the programme in their practice. So based upon these additional insights from our experts, we began to kind of refine our CMOCs, kind of tweak what we thought the mechanism might be or the context that would be required to get to that outcome. And we developed our first iteration of a mindful pedagogy to test out in schools. So this was the sort of format of it. It was a 2-hour training event for educators to come along to. It was free, accessible. There wasn't too much of a time requirement. And we also provided additional resources to support them in implementing it in practice. So you can see on the right, there's a sort of guidance sheet that we put together that they could use to talk them through the steps. So even though it was only a 2-hour session where we couldn't go into a lot of detail, they had these to sort of take away. So from the insights from the first sort of stages that I talked about, we understood that educators needed some guidance and support, but without being too prescriptive. We also had a range of resources that they could access online to support their development in their own time, so they could sort of do it at their own pace. And what was really key, which I think is where we sort of differed from other programs, was that we reiterated to our educators that this is a pedagogy and not a program or intervention. So educators could use the tools that they'd learned from the training flexibly and adaptably, rather than following a step-by-step manual. So the aim of this was to allow them to really embed mindfulness in ways that made sense in their context with their specific children. So we decided at this point to use that term pedagogy as it encompasses a more holistic, embedded teaching approach and kind of like a philosophy of being mindful rather than simply doing mindfulness at the allotted time each day and never sort of being mindful outside of those times. So we took this mindful pedagogy that we developed back to our experts, got their feedback, and we discussed how we would test it in a research capacity. We decided at this stage that we should really just focus on the educators themselves and their experience of the pedagogy, how easy it was for them to implement, and to really sort of evaluate their experience of it, the training, the resources, that sort of thing, rather than evaluating the impact of the pedagogy on the children themselves. And this was really because in order to have a successful program, we need to ensure that it can be, feasibly implemented in the first place. And although it is a combination of lots of different factors which amount to the success of the pedagogy, educators are really central to its success as they are the ones sort of delivering it. And so we really wanted to make sure that we got it right for them before we started to evaluate anything else. So the first trial took place over 12 weeks. We captured data on the educators' experiences of implementing mindfulness in their everyday practice. So this was collected through weekly surveys. I think we used Microsoft Forms so they could kind of answer a few questions week by week. And then at the end of the 12 weeks, we held focus groups with all of the educators to explore their perspectives on how it had been and what we might want to do different going forwards. So the results of the first trial were really, really helpful in allowing us to kind of further refine our mindful pedagogy. So the evaluation data indicated that actually educators still lacked a lot of confidence and didn't feel able to apply mindfulness flexibly or embody it in their daily practice. They felt that although, we didn't want to give them too much training or too much information, they did find that there wasn't enough and too much new information to sort of take in, not enough time to absorb the key concepts of mindfulness, which was a new sort of idea to a lot of them. Also, there wasn't enough time to do the sort of practical activities and have opportunities to sort of observe and model in that training session. So whilst we provided a wide range of online resources with practical tips and examples and sort of further reading, we soon realised when we explored the evaluation data that these resources, the online resources, weren't accessible to the practitioners. So early years educators often don't have their phones or their laptops on them for safeguarding purposes, so they can't actually access the online resources when they really need them, in practice, in the workplace. So this became a really important contextual factor for us to consider in our theory development going forwards. And I'll share a little bit about how one particular CMOC changed there, I think in the next slide. Another thing that emerged was that in one setting, some of the educators really struggled with the mindful pedagogy because actually learning about mindfulness can cause you to feel quite upset and emotional. This is quite a common occurrence because for some people, there's the realization that they might have been going through their lives quite sort of mindlessly in an automatic mode, not really paying attention or being very present. And that can be quite difficult to sort of realize and manage. And in one setting that we worked with, this happened to some of the educators, and they didn't necessarily have the required support from their managers to help with this. And this meant that actually it became much harder to continue practicing and embedding mindfulness in practice because they were sort of just struggling with it on the whole. So these are just a few examples of some of the insights we gained. And as I said, they're really incredibly helpful in shaping our mindful pedagogy towards something that was more accessible and more meaningful for educators and therefore for children as well. So back we went to our content expert group with these findings, and we discussed how to refine that mindful pedagogy and to address the issues that emerged. So to give you an example of a CMOC that has developed over time, here's one that we've been working with for a while. So this is in relation to what I talked about on an earlier slide. So on the left is the first version of a CMOC that we developed. This was based upon our evidence synthesis where we were just reviewing the literature. So the literature said that if early years staff have access to mindful resources, then they can practice mindfulness more effectively because they have the materials required to remind them of what they've learned in the training. But following the first trial and looking at that evaluation data and discussing it with our experts, we found there was a need to be much more explicit. And so you can see, I've put in bold here, the changes to that configuration there. So it's not just about having access to materials, but free, immediate, physical access to developmentally appropriate and accessible mindfulness resources. So this, I hope, shows the kind of movement forwards in refining our CMOCs and the way in which it helps us to, we can now use these. They're more accurate in representing what is needed in order to get to the desired outcomes. So based upon those additional insights, we were able to sort of disprove that first theory. It's not accurate, it's not capturing the reality of what is going on or what is needed to activate the mechanism. So we've come a long way. We're in August 2024. And so far, what we've done is we've used realist evaluation to develop, test, and refine the mindful pedagogy. And next, we're going to use those refined CMOCs to inform a second sort of version of the mindful pedagogy, ready to then implement and test again. So in the next iteration of the pedagogy 2.0, we took on board the feedback from the last trial. So we knew that educators felt overwhelmed by the amount of information in the last training session. So what we firstly did is highlighted how actually their existing practice, early years practice, could incorporate mindfulness easily, and it was likely they were already doing it. So it wasn't necessarily new things that they were learning. It was just a sort of shift to doing their existing activities in a more mindful way. We introduced a lot more practical activities as we found that learning happened best when they could observe and model those mindful activities and language. And we were really keen to ensure that the training event itself was welcoming and accessible. And so we were really deliberate in things like the space that we chose to meet in, making sure it was comfortable and light and airy, that there was enough space to do the sort of practical activities. We also provided some really nice catering for the day, and we kind of gave them a range of resources and gifts at the end to take away. And actually, this, although it wasn't, the crux of what the program was about, we got so much positive feedback from educators on this and found that actually it's really important to be providing them with this kind of positive, welcoming space. And actually, if you can pay for their time, even for this training, that's even better. Because what we also found was that some of them didn't attend because it was over a weekend, and that just wasn't feasible for them, especially if they weren't being paid for it. So important things to note when you're trying to get sort of buy-in. So the CMOC that I showed a couple of slides ago feeds into this second point. So we took on board that online resources weren't helpful and that some educators needed more guidance and examples of mindfulness activities. So what we did is we developed a mindfulness handbook, which is this picture on the top right here. So this was 10 weeks worth of activities that they could try, which gradually introduced them to new concepts and areas to focus on. So it was structured to support confidence building. It had a week by week structure, but we did reiterate in the training day that it was completely up to educators how they wanted to use it. They had agency to decide what activities they do, when, with who. So there was no prescribed amount or intensity or duration like you often see in interventions. So we created, as well as the handbook, we created a range of other physical resources that they could have with them in the workplace. So we made posters, storybooks, little sort of language lanyards they could keep on their person and flick through to think of kind of phrases and ideas of sentence starters. So that way they had that immediate access, and we were kind of resolving the issue that emerged in the earlier testing. We also developed a guidance document specifically for managers because that was an issue that emerged from the first phase of the testing. And really, that was to ensure that they understood what their kind of role was in embedding this approach and to make sure that they were aware of, the possibilities of what could happen and how to support their team appropriately to embed this approach. And the final thing that we added in here was that we had a research member check in throughout the 10 weeks. So this was really more so to support them in a research capacity because the educators were collecting data for us, but it also provided opportunities for the educators to discuss different activities or any implementation issues that they were having as well. So this time we conducted a much larger evaluation. So we weren't just capturing the educators' perspectives, but we were capturing the impact of the pedagogy on the children as well. And we did this through a case study approach. So this involved conducting a 10-week case study, and we worked with two different settings, and each setting had a range of educators implementing the mindful pedagogy. So they were all sort of trained on it. And these educators had focus children who they would observe over the 10 weeks. And so for us, that was important that we could have really kind of in-depth data and understandings of these children's developments and progress over 10 weeks. And we purposely chose children who with less developed speech, language, and communication skills, because we wanted to really try and capture whether it was the mindful pedagogy, whether it was kind of supporting them and developing them, more so than the educators would see happening every day. So I won't go into detail about all of these methods because there's a lot there, but we used a wide range of data collection methods to try and really make sense of the changes that might be happening when the mindful pedagogy was being applied in the two settings. We captured a range of quantitative data before and after the 10 weeks to really try and kind of compare the possible changes that might be happening. We also had weekly reflections and observations from the educators themselves, both in terms of their own development of learning about mindfulness and applying it in their practice, but also reflections on what they were seeing in their children. So they had space in their handbook where they'd write little notes around, positive or negative, any changes really that they'd seen in their children. And we also had our researcher come in on a fortnightly basis to have additional kind of observations and reflections. And then at the end of the 10 weeks, we also collected qualitative data directly with the children through group activities and also with the educators through interviews and focus groups. So these really are the findings in a nutshell, because I would need a whole separate presentation to really give you all the details of our findings. But really sort of briefly, it was a really fantastic positive outcome. We found that there were positive impacts in a range of different areas relating to children's speech, language, and communication, their executive function, their emotion knowledge, their well-being and involvement, and also in relation to educators' own well-being and their levels of sort of self-awareness and reflection really seemed to improve through embodying and embedding mindfulness in their practice. And what was really helpful as well is that early years educators gave feedback on the program itself, the way in which it was very accessible and the kind of benefits of the training and the resources. They talked about the usefulness of that sort of gradual approach rather than sort of getting everything at the beginning. And this meant they could sort of implement it and learn at their own pace, preventing overwhelm and improving the sort of sustainability of and buy-in, I suppose, of doing this program. They talked about the ease of embedding mindfulness in their everyday practices, and I think that really came from our training that we provided, that we kind of really reiterated that it's nothing new in the sense of them having to do all these activities they haven't done before. They can apply mindfulness to the activities that they're already doing. And they talked about how their confidence increased over time. And also they talked about how actually it was great that they could adapt their activities in response to their children's needs and interests. So as I talked about earlier, that notion of being mindful, of responding in the moment with flexibility and adaptability, rather than taking a child out of the room, in a separate room, doing an activity at the allotted time each day. So yeah, this kind of adaptable approach really kind of came through. And this was seen by educators as much more sustainable long term, as I said, they can incorporate it in their everyday practices and activities. So we brought all of that data back to our expert team and we continued to refine our CMOCs. And I just wanted to sort of finish by giving you a couple more examples of the CMOCs that we developed following this stage. So early on, we thought that simply if leaders and managers in the early years context supported their educators in terms of their well-being and encouraged them to kind of in their mindful practice, then educators would have the confidence to apply it in their practice. We weren't sure of the mechanism earlier on at the time, and we thought that might come out when we did the second trial. But actually, what came out of the trial was that it wasn't simply leaders and managers who helped educators with kind of embedding this approach. So one of our educators had quite a different experience to the others. So they were in a different classroom and none of their colleagues were doing the research, were involved in the research, and they weren't embedding a mindful pedagogy. And they say here, you need to have everyone doing because then it becomes embedded. And if you're not all sort of doing it together, it just doesn't happen. And so this really sort of highlighted to us the need to have that kind of whole classroom consistent approach, and the need to have sort of peer support as well. It's not just your manager supporting you, it's everyone in the room being on board. So we use that data to refine our CMOC to actually consider that importance. So the context changes from not just being leaders and managers to actually being, okay, when we've got peer support and whole classroom participation, then we're going to get to that outcome. And actually, the reasons behind this is that practitioners have agency, a sense of support, and they feel part of a consistent community of practice. So again, we've sort of disproven that first kind of theory or hunch around what we think is going on based upon testing the program and the evaluative sort of data that we got from our educators and other kind of data collection methods as well. To give you just one more example, our findings from the initial evidence synthesis, so before we began the trial, said that in order to ensure that children could engage effectively in mindfulness activities, they need to be below 15 minutes because children's attention spans are too low and they wouldn't be able to remain engaged for any longer than the 15 minutes. But actually, through conversation with our experts and through data from our second trial, so this is from our second trial, we found that children could actually remain deeply involved and engaged in a mindfulness activity for some time. So this educator here talks about how she followed her child's lead in an activity that they were interested in, and they applied a mindful approach to doing that activity. And actually, this child was involved in that activity for a good hour, being mindful. So the way in which she did this was that, they're playing with Gloop in a mindful way. They're looking at the five senses. They're verbalizing how it feels, looks, smells. They're zooming in and out of different details. And so rather than introducing a new activity to do these things, they're working with an existing one. So again, all of this sort of insight that we got helped us to develop our CMOC. So actually, the context is when mindful activities capture children's interest and attention, then they are likely to benefit from a mindful approach. And this is because they'll have higher levels of involvement and they can remain engaged for longer and more deeply. So as you can see, there's quite a drastic change in that context, but we feel that now captures the reality of what goes on or what we would want to happen in order for the mindfulness pedagogy to be successful. So coming to the end now, I know we're close to sort of 10 minutes left. So we're now at the end of our current funding for our research project, and we've got to a really great point where our sort of theories and our CMOC development feels really nuanced and well developed. We've gone from sort of hundreds of fairly broad and inaccurate CMOCs to around 40 really accurate, really complex CMOCs that we think really capture the reality of a successful mindfulness approach in early years. But it is important to recognise that our results that we got, although they were very positive in that second trial, they must be interpreted in line with the flexible nature of the pedagogy. So although there was really positive feedback from the teachers on the mindful pedagogy, we can't claim that these positive changes to the children's development were solely because of the mindful approach. There's a possibility of bias here. Because the teachers were on board, they were engaged. And so actually what we would like to do next is a further sort of testing where perhaps we have a sort of control environment so we can compare the results against a setting that hasn't had the mindful pedagogy embedded in it. And then we'll have really sort of kind of strong evidence to support our mindful approach. So we're looking for further funding and we're looking for settings who might be interested in testing out that next stage. We also have been reflecting on the fact that the early years settings who were involved in this project were really keen, they were really committed, they were eager to learn how to embed and embody mindfulness in every way possible. So we're kind of curious and thinking about how this might emerge in contexts that are less eager, less on board, perhaps those with conflicting interests or priorities. And so we really need to engage with some of those contexts to further develop our theories and make sure that they also apply to those that maybe don't have such a keen interest in mindfulness as well. And we also sort of wondered whether our researcher coming into the setting might have impacted on the findings. So, although it was in a sort of research capacity, helping them with kind of data collection, it could have been seen as a kind of support system for the educators. And so we want to sort of test it out again, where, if we want to have this mindful pedagogy scaling up across the country, we can't have a researcher coming into every school and giving them, one-to-one support. So we need to figure out whether that might have impacted on the findings as well. So my sort of final reflections on the realist approach is that what's really great about a realist approach is that it acknowledges the context in which things happen. So in the early years context, there are many nationally recognised interventions. For example, the Nelly programme is designed to improve language skills in early years. And although it's been proven and highly evidence-based to be very effective, many educators have commented on the fact that it's too adult intensive and it can't be implemented, long term. They just can't maintain it. So through a realist approach, we now really deeply understand the complexities of early years contexts, and we've designed, we hope, an approach that is flexible, adaptable, embedded in everyday practice, and therefore more realistic to actually implement. Using a realist approach has also helped us to really unpick the wide range of often hidden mechanisms that result in successful outcomes. So now we have this understanding, we can refine our mindful pedagogy to ensure that it really activates those mechanisms in practice. And finally, I think for us, the real benefit of the realist approach was gaining that deep understanding of what works and why from multiple different perspectives. So our content expert group were really, really central to that. And we think that that is probably the main thing that has really made Little Minds successful in practice. So thank you so much for listening, and welcome any questions or comments that you might have about the project. Thank you.
Danny?
Thank you. That was really interesting, and it's my first explanation that I've had of the realist approach. So, but am I right? The research question that you were really focusing on is that if mindfulness is a useful a useful addition to the teaching of people in early years, how would it be best brought in a practical and sustainable way, rather than whether or not it works? And whether mindfulness works is something that you would then test using the controlled method that you suggested. Have I understood that correctly? Is that?
Yes, absolutely. So what we hoped at the beginning, we thought that we could sort of dive straight in and figure out how or whether mindfulness does impact on speech, language, and communication. But actually, what we found is that if it can't be implemented in in an effective way in the first place, then there's no point in testing that. So our aims actually have changed and evolved over the course of this project, because we just realized that we need to get that first bit right. But you're absolutely right, Daniel. And Eleanor, do you have something to add?
I was just going to say,
part of the team as well.
Thanks. I was going to say that when this project was first bid and first conceived, it absolutely was conceived as an intervention. So it's actually been part of the research and content expert group discussions and analysis that has led to it becoming more of a pedagogy than an intervention. So it's been part of the kind of process, the learning process for the team. I mean, the first research question really was about, can mindfulness help improve children's speech and language? That was essentially the first kind of underpinning, sort of driving force of the project.
I think it's a fascinating topic, because I'm doing quite a lot of work in early years too, looking at the impacts of various trainings, and some of it I don't know any of them in great detail, but some of them appear quite formal in terms of the approach, and maybe there's some flexibility in terms of what you might take from a work manual or something like that. The question is, I suppose, how do you create real change in that interface between the early years practitioner and the child in the day-to-day life of a setting or a school? Does a sort of fixed, rigid approach work, or is it about I don't know, inducting people into, like, an approach into a way of thinking about how you approach the day and how you manage yourself?
If I can answer that as a practitioner,
no, please go ahead, Lola.
I started
my
life
throat.
as an early years teacher before I came to university. So I think what's critical is confidence in your practitioners and belief in what they're doing, because any kind of half-baked delivery of a manual or an approach is never going to have the same impact as someone who truly understands what they're doing and can apply it. So, and this is absolutely what Lois was saying, that actually our first focus was about how we work with the adults in that setting and how we empower them to embed and embody the mindful pedagogy, because if we can't get that right, then it won't happen for the children.
Mm.
And I'd be interested to hear from anyone else who's dialed in today, whether you work in early years and you're doing something that's similar to this, or that you think it could be useful to maybe do a bit of this in wherever you work, and anyone who's working on realist evaluation as well, around whether there's anything in the approach that was taken here that interests you, that also resonates with something that you might have done. So does anyone have anything to share, any experiences or projects or programs that they're working on at the moment? Lisa?
Hi everybody, thank you so much. It's been an amazing morning. So just a little bit of background for me. I'm actually just finishing off my PhD, exploring mindfulness in early childhood education in Ireland, because it's something that really isn't explored here. So it's been really interesting. I've been a mindfulness practitioner and teacher for about, 10-15 years now, and it's something I've brought into the practice. But I suppose what's really inspiring about this is the whole thing of a mindfulness pedagogy and looking at that, because a lot of my research and work that I've done is all about these curriculums, and from talking to the educators in Ireland, they don't want another curriculum because they feel it's just going to be left on the shelf. So it's being able to kind of, I suppose, get in, maybe even to pre-service educators, getting into colleges, getting into training, to make this kind of like, this is how we teach, this is what we do, to make that kind of like more sustainable. So yeah, this is amazing, and I'll be able to add all this into my my PhD as well. So just thank you so much.
Thank you, Lisa. I think, one of the things that I think is really important, and which is why we're trying to collect so much sort of evidence to kind of demonstrate the kind of impacts of this, is that although, mindfulness lovers are going to kind of see the importance of it and the impact of it, and it becomes a lot easier to kind of embed in your sort of day-to-day practice, I think it's for a kind of wider sort of buy-in from early years kind of context. I think sometimes there is that need to have that kind of hard, like, evidence base, and so and that's sort of at odds with a sort of flexible pedagogy, isn't it, where things are sort of different. So I think we've had to really find that balance of capturing evidence which shows the positive, or just general the kind of impacts of it, whilst also saying that there's no one way of doing it. And that's quite a difficult balance to have, I think, but something that we hope we're managing to do in this work.
Yeah, and I think also our research and this trial has really shown that, you sort of mentioned this earlier, Lois, that it's not a whole new world. It's not like shifting your entire practice completely. It's about almost like focusing the educator's lens when they're teaching on specific aspects. And if you work in early years, very specifically on those sort of prime areas and the characteristics of effective learning. And if you can have that core focus in everything you do on those things, it brings out the best in everything.
We've got a question from Gareth Honeyford, Strategy and Development Lead in Essex County Council in Education, who asks, who says, I wondered if there was any consideration given to intersection with mindfulness and neurodiversity, as I seem to remember reading that mindfulness does not always serve neurodiverse individuals well. And in brackets, I could be wrong though.
Yeah, I think that certainly when we did our initial sort of evidence search, there were kind of particular groups such as those of kind of neurodiversity who did sort of engage in different ways with a kind of mindful approach. And so I think we had to really strip back, you know, mindfulness with adults is going to be quite different to mindfulness with children, and some you know, thinking about the way in which we developed activities, the language we use, making sure it was concrete and not abstract, and those sorts of things, you know, I think are really helpful to working with, you know, neurodiversity and generally with kind of children at different sort of developmental levels. So I think that, yeah, we didn't want to create something that just focused on particular groups. We wanted something that did sort of work for everyone, but that did certainly emerge in some of the reading. Eleanor, what would you add?
Yeah, I was going to say, I mean, we were very particular in our training to talk about kind of the professional knowledge that each educator has of their children, whether they're neurodiverse, whether they're SEN, whether they're not labelled as anything, if they're, you know, labelled normal or normative development. Actually, every child responds very differently to different things, and the sensory thing is a particular one in this respect, if you like. So the example Lois gave of a child sitting and playing with gloop is not something that every child would want to do, and that is, I guess, what we feel is like a real USP of this program or this approach is that it can be tailored to the needs of the children that you're working with. So yeah, we didn't have in this particular trial any focus children who specifically had been diagnosed with neurodiversity. So we don't have hard evidence either way, but I think we have deliberately, like Lois said, made it such that the professional knowledge of the educator enables them to adapt it to the needs of those children.
Fantastic. Matt?
Yeah, hi. Yeah, thanks very much indeed for this. I've got a couple of questions. They may be out of scope, so I do apologise if they are. The first one is, I am particularly interested in mindfulness in education, and so have you looked at it across these sorts of these really important liminal points, like transition from early years to key stage 1, key stage 2 to key stage 3, you know, primary to secondary schools, etc. That's the first sort of question. And the second sort of corollary to that is, have you thought about the impact of mindfulness on the educators as well? So if you're getting them to deliver this within the classroom, how is it impacting on them? Are they getting a better experience? Is it impacting on is it having a positive effect from the educators? Sorry, thank you.
Yeah, in answer to your first question, I would probably say no, that we haven't. I mean, I guess we've done kind of broader reading around how it's been implemented in different kind of key stages, but we haven't certainly kind of focused on that. But in relation to your second question, although that wasn't the focus of our project by any means, you know, we're really focused on children's developments, a very unexpected outcome was all of these positive developments and outcomes for the practitioners themselves. So, you know, we did end up measuring their sort of well-being kind of before and after to see how that might have kind of impacted.
What did you use to measure the well-being?
Well, interesting. So we used, what was it called?
A reflective practitioner tool, which also included some, which had been developed around specific facets of mindfulness.
Yeah.
And
so
then
there
we
was
added in some from the wellbeing scale, the teacher wellbeing scale, the Edinburgh.
Webs.
Yeah.
Webs.
That's the one.
Yeah.
So
that's mental health wellbeing. Anyway, go on. Yeah.
Yes.
So we were curious
the whole
about
combination in our practitioner reflective tool, which was mental health, wellbeing, all sorts.
Could I catch up with you later, if that's possible? Because I'm really interested about how we can apply some of these things in the work we're doing across Essex, looking at
Yeah,
particular
absolutely.
teaching.
Sure.
Feel free
But
to
I think
email us.
equally with your first question about that transition point is really interesting, isn't it? And certainly I was sort of talking in the chat while Lois was presenting that one of the key strengths that's come out of this is really the power to support children with co-regulation and self-regulation, and that understanding of dealing with challenging times, sitting with difficulty, and recognizing that experience will pass. So I think it absolutely applies really strongly to that transitional approach, transitional moments.
I think what's emerging quite strongly in some of the work that we're doing is the sort of looking at feelings of belonging and feelings of self in young people as well. And you know, and if there's any way of sort of tying this type of stuff together, I'd be particularly interested, because you know, it's about how do you apply approaches that are going to have really sort of positive impacts on people's health and their educational outcomes as well. So it's trying to think about that combination.
Yeah, I mean, it's a core outcome of mindfulness is about sort of that emotional regulation and improved sense of self. So it absolutely applies.
Thank you.
Fantastic. Can I ask a question about? I love that process map that you've got of the project and all the different stages. I think it's brilliant. But what dawned on me is that if you're going to go through those steps and stages, you need time at each step to do analysis, to reflect, to flex, to adapt. We're often working in quite demanding circumstances when we do applied research and evaluation. Often people want impact data straight away, and quick reporting deadlines and all that kind of stuff. So I'm really interested to know, how were you able to create the space to do all this reflection and adaptation? In some ways, you needed to create the space to be mindful for yourself, right? And I'm just interested, taking a realist approach to this, what contextual factors helped you do that? Is there anything about operating in an academic environment that makes that more possible? I don't know. But also, what kind of tensions might have there been at points where you thought, we need to think about this a bit more, but actually maybe you were being rushed onto the next step? Anything around that would be really useful to hear about.
Yeah, I mean, I guess to put it quite bluntly, we were in a very privileged position where we had a funding for 2 years. You know, I was employed on a full-time basis, really, just to go through all of those stages. So it did take, you know, to do it really well. I think we have done it pretty well. A dedicated person kind of leading that, with other kind of team members coming in and, you know, meeting and that sort of thing. So I appreciate, I'm not really sure exactly how that would look if it is a kind of smaller team or less time, or maybe it takes a bit longer. There are certainly things you can do to reduce it. So with the realist evaluation, evidence synthesis, sorry, at the beginning, that can go on for months and months and months and months. Or you can do what they call a rapid realist review, which is a much sort of shorter version. So there are certainly ways in which you can sort of speed it up a bit, but at the same time, sometimes you do need to sit and think on it, reflect. And, you know, there were times where we would kind of have a conversation with our experts, and it wouldn't be for a few weeks that we'd come together and be like, oh, so maybe this means that's the mechanism. And so it is a slow process, and it is important to, you know, it's a reflective process. The whole thing is reflective, isn't it? So yeah, I'm not sure. Eleanor?
Yeah, I was just going to say, also, I think your background, your prior background knowledge also has an impact on that. And sometimes it can be a barrier, sometimes it can be a help. So when I first started working on this project, having a background in early years, I could instantly see the links between mindfulness and the curriculum that exists for early years practitioners, and also approaches like trauma-informed approaches that are used quite commonly in early years with children with adverse experiences. So that background knowledge that I already had within early years practice worked to my advantage in some ways, maybe in disadvantage in other ways. I didn't know mindfulness as much when I first started, so that was an area I needed to understand more. Lois came in with a very different, you know, fresh perspective, because she hadn't worked in early years and she hadn't worked in mindfulness, so maybe was asking quite pertinent, quite, you know, specific questioning that really helped us unpick maybe prior experiences or things that we maybe took for granted. So I think that the other powerful thing about this project was the combination of people that were brought together, both within the research team. Kate, Kim, Lois and I all come from very different backgrounds and all bring something different to the table, but also that content expert group bring different perspectives, and multiple perspectives, you know, is absolutely a core to getting things, I would say, things done quicker, better, or more comprehensively, because you're able to explore a wider, and more comprehensive approach.
Fantastic. There's so much to unpick, and I'm so glad we've recorded, because it's a really good example of applying realist evaluation to an applied setting, but also working through those stages of developing and testing an intervention and gradually building it up over time. I think it's a great piece of work. And Luigina.
Yes, no one has ever said my name correctly for the first time, so thank you. Thank you very much for the presentation. It was amazing to listen to everything you've done, honestly. What I'm interested in asking a bit more about, I remember you mentioned that you had educators monitor some of the children for about 10 weeks, right? Yeah. So I work for the Institute of, it's in Italian, so I have to translate it, Research Institute for the Evaluation of Public Policies in Italy. And one of the core fields that we work in often are tasked to evaluate are interventions to contrast educational poverty in Italy. And so we work a lot with teachers and educators, and what we often find is they are so overwhelmed by activities that they have to do regularly that when we go and ask them to collect data for the evaluation or to very easy tasks, they are so overwhelmed that they're like, no, too much, we can't do it. So I was wondering, how did you create that buy-in? Because asking them to monitor for 10 weeks is quite a lot. It's a big ask. So I'm wondering how you created that buy-in from them and that collaboration. Thank you.
Go for it, Eleanor.
Yeah, so I come, like I said, I come from a practitioner background, so we absolutely were really, really mindful, if I can use that word, that whatever we did had to be doable alongside a day. So actually, in the preschool setting, each key worker only had one focus child to monitor. So when they did their reflections, their weekly reflections, or their capturing data, information, it was purely about reflecting on that child and their own experiences. So it was a manageable amount, if you like. Okay. We had quite structured, if you like, reflective prompts on a weekly basis. They were the same prompts. So what we found reported to us by the practitioners was that they were like, actually, I know what prompts are coming up, so I'm thinking about it as I'm watching that child, and as I'm working with the mindfulness, I'm already thinking about what I'm going to write down. We also give them sort of just, the usual, like, little post-it notes. So if anything happens in the moment, just put it on a post-it note, stack it in. And they had a companion handbook that they had that sort of went through the weekly process, if you like, and they put their prompts. So we put everything together in one spiral bound book that was very easy for them to access. They had at the setting, and yeah, it was kind of those regular prompts that they knew were coming up. The just post-it notes for any other additional kind of commentary. The bigger research tasks I undertook when I went in at the beginning and at the end. And then the only other sort of formalized, if you like, research task was something that they used a dictaphone with, and they had a conversation with the child. So was not too onerous, because it literally was just tell me about, and capturing one kind of, narrative utterance.
Yeah, I think you know, we were very lucky that we had two very keen settings who, you know, we had a lot of conversations early on about what is manageable for you. You know, we'd like to capture this information, but you know, what do you feel able to do that? And so we didn't, you know, necessarily say you have to do all these things. It was more of a sort of dialogue, I think, as well at the beginning when we did that first sort of training day.
Yeah.
And also, I guess it's important to remember that.
Well.
Sorry.
I was going to say we also used assessment processes they already had in place.
Yeah.
So one of the language tools one of the language screening tools they already used in these settings, we used as a starting point and end point as a way of screening the children's language development. So it was already familiar to them and it was something they were already doing anyway.
Yeah, but I agree with you. I think it can be tough. And I think when we carry on with this project, it will be interesting to see who else wants to engage, because we did feel very sort of lucky to have those settings. And obviously, this is in a research capacity that we need to sort of collect this data. And when we scale up the mindful pedagogy just to sort of to provide and deliver, there won't be that data collection element. So it's just sort of finding settings that are on board that see the benefits of being like a research partner as well. We did frame it as that they are, you know, our co-researchers, they're involved in it as well. And I think that sort of sense of ownership helped them as well, I'd say.
Thank you.
We've Gillian Westhope, I'm not sure if you, when you said happy to discuss later, you meant in this meeting or a later date. I don't know if you want to come into the conversation or just put a message in the chat, but there's something in there around realist evaluation.
Yeah, she's talking about the context, that usually in a CMOC, the context is something you don't have control over as an interventionist, that it's a contextual element that is just there. So
yeah,
if you wanted to come into this chat, that would be great. Yeah, I've just noticed to do either.
So I'm Jill Westhope. I'm a realist methodologist, and I work from Australia. I'm going to get very realist, boffin-ish, just for a minute. So the way realists use the term context is that it's a specific feature or factor that affects whether and which mechanisms fire. So at the moment, you've got to the point where you've got a number of things about the intervention itself that affect whether and which mechanisms fire, and that is a fine and beautiful place to be at this stage of the development of an intervention. And your mechanisms really are mechanisms, which is not always the case. So I was really pleased to see that. However, from a realist perspective, we're always going to assume that it doesn't matter how well developed your intervention is, it's still only going to work for some people. And by work for some people, I mean both the teachers and the children. And it's still only going to work in some circumstances. And it's the circumstances that affect the which children and the which adults that really need to be teased out in order to be able to scale out. So my hunch would be that it's actually too early to jump to a trial, and that in fact jumping to a trial may never be the right thing. But even if it is the right thing at some point, it's probably too early to do it now. That what you need to be doing as the next stage is putting the easy technique for doing this is to say, okay, these bits about context about the intervention itself and how it's implemented, we'll call those I for intervention. And then we will work out what's the C in which those aspects of how we implement the intervention work. And the context there should be both the for whom and the in what circumstances. And when you do that, then you start to work out, oh, hang on, it works for this version of neurodiversity, but not that particular version. Or it works for people who've got both peer support and manager support, but not either or whatever it might be. I'm making stuff up based on the presentation, which, by the way, I loved to bits and, think is fabulous. I think the work you've done is fabulous. I'm really pleased to see it. But I wouldn't jump straight to a trial yet. I would take that realist thinking a step further first and think about how do you get scaled out to the point where you have sufficient both evidence to suggest that it will work scaled out and numbers to warrant a trial if a trial is ever actually appropriate or necessary.
Thank you. That's really
Just a
helpful.
suggestion.
Yeah, thank you. That is. And I think this is something that we became quite aware of over time, that what began as identifying the context, which is sort of unchangeable, did sort of change to be like, oh, okay, well, if we can control this part of the context and we can figure out what that looks like to result in those outcomes, then that's something that the program can do. But it's obviously, it is a lot more than that, isn't it? And yeah.
Yeah. Can I just say, I don't agree that the context is always unchangeable. I think that's a misunderstanding. It's more like, that's thinking of context as the setting. You know, we can't change the setting into which but that's not context in the realist sense of what is the particular factor that affects whether or not, or the particular few factors that affect whether or not this mechanism fires. How interventions work is often by changing the context.
Mm-hmm.
So it's not helpful to think of the context as being unchangeable, I don't think.
Mm-hmm.
Forgive me being blunt, but, you know, being hasty in a meeting so as not to take up too much time.
Thank you. No, that's really helpful.
Thank you.
Thank you.
That's fantastic. Thanks, Jill, for coming in with that reflection and those thoughts. It's certainly food for thought, I think. It's quite complex work, realist evaluation, and getting our head around all the different factors and putting them in the right order and describing them in the right ways is always a bit of a challenge in realist evaluation. But it's great stuff. This is what this forum's for, really, is just sharing thoughts and reflections on projects. So, any final comments or reflections from anyone else before we bring things to a close? No, I don't see any hands raised. So I would like to thank Lois and Eleanor for an absolutely fantastic presentation. It's been brilliant. I'm so glad we've got a recording. There's so many people that I think will want to see this immediately, and so many people that I will refer to the presentation as a great example on so many different levels of how to do evaluation work and develop projects along the way. And also thank you to everyone else for dialing in. For those of you who have stayed with us for almost 90 minutes, well, a special well done to you. But if you're external to Essex and you'd like to be kept updated about anything that we do in the future that we will open to the public, just pop an email address in or contact me on LinkedIn and I'll keep you updated. But thank you for everyone for your time today, and enjoy the rest of your day.
Thank you for having us, Mike.
A pleasure.
Thank you. Bye-bye.
Take care, folks.
Mike, sorry, will we get the presentation slides? Is it possible?
Good question. Yeah.
Yeah, happy to share them. Yeah.
Thank you.
Thank you.
Yeah, fantastic. Thank you very much. Bye-bye.
Bye.